A seizure is an abnormal, unregulated electrical discharge that occurs within the brain's cortical gray matter and transiently interrupts normal brain functioning. Seizures can be caused by a variety of conditions, including genetic syndromes, chromosomal deletion or duplication syndromes, metabolic disorders, mitochondrial diseases. Seizure disorders can be caused by single gene mutations, idiopathic or unknown origins, infection, fever, and head trauma. Seizures are classified by the involvement of one or both hemispheres of the brain. They are classified as focal or generalized. Focal seizures were previously referred to as partial seizures. Focal seizures involved one hemisphere of the brain. They are separated into simple and complex focal. Simple focal seizures. The patient may experience an aura prior to the onset of the seizure. This can be visual, auditory, or gustatory. They do not typically lose consciousness and are aware of the seizure occurring. Generally, it's localized to one muscle group, such as an arm or a leg, and they typically last around 1 minute. Complex focal seizures, they may experience a loss of consciousness. They may scream, gag, or smack lips during the seizure. It may last up to 2 minutes, and they may experience a post-ictal phase after. Generalized seizures involve both hemispheres of the brain, and they are separated into several categories, including absence, atonic, myoclonic, infantile spasms, and febrile seizures. With absence seizures, the patient may have an altered level of consciousness, staring episodes, they may blink or move their mouth, and they usually last around 30 seconds. Atonic seizures were previously named grand mal seizures, and they have 5 distinct phases: muscle contraction, muscle extension, tremors, a clonic period, and a post-ictal phase. Febrile seizures occur due to the rapid increase in body temperature. The ages usually range from 6 months to 5 years, and it is a protective measure for the brain related to that increase in fever. Myoclonic seizures may experience sudden jerking of the muscles, the child may fall to the ground, exhibit unusual clumsiness, and they may hiccup or smack their lips. Infantile spasms occur in infants younger than 6 months. They may occur while the infant is falling asleep or awakening from sleep. They may occur in several second clusters and have brief periods of moving the neck, the trunks, and the arms. Status epilepticus seizure is a medical emergency, a seizure that lasts longer than 5 minutes or having more than one seizure within a 5-minute period. Diagnostics for seizures include an EEG, a CT scan, and an MRI of the brain. Treatment for seizures are based off the type of seizure. They can include anticonvulsive medications and an implanted vagus nerve stimulator. Patient and parent education is important. Try to prevent a fall by laying your child on the ground in a safe area. Cushion your child's head. Loosen tight clothing, especially around the neck. Turn your child on their side in case vomiting occurs. Stay with them until they recover, and cool the child if they are experiencing a fever. Call 911 if this is the first time your child has experienced a seizure. The seizure lasts more than 2 to 5 minutes. Your child does not awaken or behave normally after a seizure. Your child experienced a seizure while in water. The seizure appears different than normal, and another seizure starts soon after the first one ends. This chart is very thorough and goes into an in-depth description of the characteristics of the different classifications of seizures. This chart is a very in-depth and thorough chart of the medications commonly used for seizures, including Dilantin, Keppra, and phenobarbital.